So my name is Shellye Horowitz, and I have six generations that we can trace of hemophilia in my family. So it's something that goes back many, many years, actually spanning over 176 years back to my great great grandmother. And it may go back further. That's just as far as we can trace. And I, like many, many women, have watched the men in my family access diagnosis and care really early on in their lifetimes. And as a woman myself, I had multiple situations in my life where it was very clear I was bleeding, and no one even thought that it might be connected to hemophilia. So I did not get my official diagnosis until I was 45 years old. There are a lot of little bits of my story that weave in and out for most women across the world, really. They're not checked because it was always believed that hemophilia was a male disease. And we know it's not a male disease, but because it's X-linked, there used to be a belief within the scientific and medical community that X-linked diseases were dominant versus recessive. So therefore, you would, as a woman, would need to get two impacted X's with a hemophilia variant in order to actually manifest disease. We now know that that is not the way X-linked diseases work. It's a matter of penetrance, and it has to do with a process called X inactivation, which happens really early on in embryonic development. Women do not need two X chromosomes in every cell, so half of them go silent during, and they inactivate during early development. And people used to expect that the good X would stay on and the bad X would turn off, and it just doesn't work that way. It's completely random. So women can skew high or low. So I have a relative who skewed high. Her factor levels are in the 80s and 90s. She's great. She carries hemophilia but does not have it. Women are expected to skew in that mid-range of 40 to 60%, meaning many of them won't have a lot of symptoms. Some might. And then some of us skew low. So my sister and I both skewed low in that random process and ended up with a hemophilia diagnosis. So I just didn't know. In my particular life, we have an interesting story because when I was 10 years old, my dad had a really with it bright hemophilia doctor that did understand that some women could bleed. So she had them brought in to his hemophilia treatment center to be tested. And my sister's levels were drawn right away. They hit her vein. Her levels were over 30 that day. And for me, they struggled to hit my vein. They ended up at literally, it was an hour. My dad was yelling at the nurses. It was a really big kind of production, and they ended up pinning me down, kicking and screaming an hour later with a pediatric specialist to finally pull my blood. And I also showed in over 30. And at that time, they believed that any levels over 30 were adequate for hemostasis. Today, they know that's not the case, but back then, that was what they believed. And my actual levels are much lower than 30%, and they didn't know that stress would raise levels. And it's actually pretty amazing. The year was 1983. And if they had hit my vein on the first try and they would have gotten my accurate levels, I may not be here speaking to you today because any level under 30 was treated with major bleeds at that time. And that was when we had an infected blood supply. So I'm thrilled that I got a late diagnosis. It saved my life. And it's just fascinating the way that worked out. So I actually have a piece of paper in my medical record that says levels over 30, low but adequate for hemostasis. And my parents saw that and never, ever thought about hemophilia again, even as I had blowout bleeds that would cause my entire leg to be black and blue. Never occurred to them that it might be connected to hemophilia because they were told after this test that I don't have it. First of all, I didn't manage it well. When I would be hurt, it would be months and months of healing. it could have been incredibly dangerous. And there were times in my life where I definitely should have had factor. It can cause amazing damage. So untreated bleeds means joint damage and pain and potential for the need for early joint replacement. So there are a lot of things that can happen when you're not treated well. I had a car accident with a head injury that took years to heal from. And I really believe had I had the appropriate intervention and factor medication that I would have healed significantly faster. So it's really important. And I'm glad you bring up that question because this is still an ongoing battle across the United States and across the world. The idea of when do we test girls in particular for hemophilia? If a boy is at risk, they are tested as close to birth as possible. But many doctors are still saying to parents of young girls, we can test them before they menstruate. Don't worry about it. And I find that incredibly dangerous, and we need to change this practice. If we know that an obligatory carrier who is a woman who is born whose father has hemophilia, so we automatically know dad can only give their ex to a girl, they definitely are carriers of hemophilia. We know that at least 30% of those girls are going to have levels low enough to be diagnosed. And yet they're still being told that they can wait until after menstruation. And to me, what is really dangerous is that what happens to the 2-year-old who's in a massive car accident and does have hemophilia and no one knows it. They're not treating that girl properly. And what happens when they show up at a rural hospital who doesn't know to test or treat for hemophilia and they don't have a medic alert bracelet on their wrist? So this is one of the areas that I'm quite passionate about. It is so critical that girls are afforded the same rights as boys and afforded the same respect and the same respect for their life, and that they're tested really early on to make sure that in any accident or emergency, they're going to be properly cared for. That's a good question. It's a rare disease. I know other rare diseases are on newborn panels, and there have been people within our community who have talked about that, but at this time it is not. And I will say, newborn panels are only part of the solution. In many cases, we know a family history and we know to test because we know that that family history exists. About 30% of hemophilia cases are spontaneous. So they've had a mutation that the family wasn't aware of. But in the other 70%, we know that hemophilia is in the family. And yet, doctors still are not testing. So there are two different tests. There's that genetic test, which verifies that someone has a variant that could cause hemophilia. But then there's also that factor level testing for women that actually shows whether or not they're more impacted. This can get very nuanced and complicated because women whose levels are 40% or under are supposed to receive the same mild hemophilia diagnosis that a man whose levels were the same would receive. However, some women who are carriers of hemophilia, even at higher levels, 40, 60, 65%, will still show some symptoms of excessive bleeding. And in those cases, they're referred to as symptomatic carriers, which is not an ideal term because it can often involve dismissal of symptoms. I think I have a few messages, and the first one is test early. Let's not risk a young girl's life or their medical license for a test that costs $200 or less that most insurance companies will pay for. Test early so that we know for sure that if the young woman or the infant girl is in a major accident, needs a major surgery, we know right away whether or not they need to be treated. So that is one message. And the other message is that it's really critical to get to know an individual woman's bleeding story. And that's something that isn't always easy to do. So ask for photographs of bleeds, ask for PBACs, which a PBAC is an assessment of menstrual bleeding and looking at how much blood loss is occurring within a period. Check it out. Is it normal? Is it abnormal? And really, really start to dig deeper What I find is that there are situations where a woman will come in and say, I'm bleeding, I really need help. And a doctor will dismiss the bleeding. And I find that that dismissal, when a woman really needs help, often lies in a misunderstanding of what that bleeding story really looks like. So I have had the privilege of looking at some of the data and some of the key findings for, in particular for women with hemophilia, because that's what we're talking about. One of the things that stands out so much to me is age of diagnosis. So over 59% of the women that they surveyed were over 25 years old by the time they received a diagnosis. And when I dug deeper, over 22% were over 35 years old. So delayed diagnosis is an issue, and delayed diagnosis means delayed treatment. So that's a concern. And in the past, years ago, there was a study on von Willebrand disease, and it was conducted in conjunction with the CDC. And they noted that women with von Willebrand disease, they surveyed 75 women and they had made it to a treatment center. So I feel like it might have been a slightly biased group. And they proclaimed that from onset of symptoms to diagnosis, it took 16 years. And that has been generalized to all bleeding disorders in women. And when we look at the results of this study, what we see is that for women in hemophilia, the age of diagnosis is really a lot older statistically, and that's more in line with what we hear from the community and the stories we hear. So that's concerning. Also, many women reported, I think it was about 65%, that it impacted their ability to start a family. And there may be many reasons for that. It may be a biological reason. There are also reasons connected to worry about passing on a variant that could cause problems in their children. So that was a concern. And 70% said it impacted travel and levels of physical activity. And I'm definitely in that 70%. When I was growing up, my ankles hurt constantly. I was in pain. I was called lazy by my gym teachers. My parents were told I was making up excuses to not want to participate in sports. And that was anything but the truth. I wanted to be out there. I was jealous of the people who could. And I thought I was weak. I thought all kids had this pain and I just couldn't overcome it. And I can say that since I've been diagnosed properly, now that I'm on what's called prophylactic treatment, which means they're now preventing bleeds before they happen with me on continuous medication, I am in less pain as an adult than I was as a child. In fact, I'm in no pain most days as an adult, and I was in pain constantly as a child. So there is that reality, and I dance up to 2 hours a day. So I am now in a position where I can be as active as I wanted to be as a child, and I have proven that I wasn't lazy as a child. I really did have a physical issue preventing me from being active. And the other thing that I'll say, and I think this is really important, and again, something I personally experienced, is that women with hemophilia, many of them have reported being diagnosed with anxiety or depression. And it makes sense. When you know that there's something wrong with your body, you're being gaslit and turned away by professionals, it ends up greatly impacting your mental health. And again, I personally found that all those diagnoses disappeared when I was finally believed, when I got the treatment I needed, and I could live my fullest life regardless of the fact that I happen to carry a variant that causes hemophilia. I love that Sanofi is really looking at focusing beyond the diagnosis. And what I love about this particular video series is that it focuses on individual people and their stories. And that is so important when we're looking at hemophilia to go deeper and look at each person and what they bring to the table and how they uniquely give to the hemophilia community, to the greater community. And I think that it's really important. I will often hear women, once they're finally diagnosed, it seems to be that there's a great focus on menstrual bleeding, which is important because it is something that most women with hemophilia will struggle with, in addition to all the joint bleeds and muscular bleeds and other bleeds that men experience. So we experience all those bleeds plus. So we have that extra category. But women will also stop and say, I'm more than my uterus. Look at me. Look at the person. Look at my whole bleeding story. And I also experience all those bleeds that men experience too when bleeding. And I also think that many women will say, we were little girls who didn't menstruate. We're older women who are in menopause. And our bleeding story is more than the years that we can procreate. It, our bleeding story is before and after and over our whole lifespan. And I love that this series really looks at people. It's a fantastic series. They've done an amazing job.